There are 14,659 confirmed aggregate cases of coronavirus in Victoria. That's 394 more than our last update. I'm saddened to say that there have been 210 deaths due to this pandemic in Victoria. That is an additional 17 fatalities since our last update. They include 2 males in their 50s, 4 males in their 70s, 4 females and 2 males in their 80s, and 2 females and 3 males in their 90s. To each of those families we send our sincere condolences, our sympathies, our best wishes. This will be an incredibly difficult time for them, and I want them to know that they are in our thoughts and prayers as we continue to do everything we possibly can to deal with this second wave and to get beyond it. 10 of those 17 deaths are linked to aged care outbreaks. There are 634 Victorians that are in hospital. 43 of those are receiving intensive care. 26 of those Victorians are on a ventilator. A total of 1,801,385 tests have been processed since the beginning of the pandemic. That is an increase of 41,416 on yesterday, so a massive testing effort. And again, many thanks firstly to all of those who are coming forward even with the mildest of symptoms, and again thank you to the very large team across laboratories, both public and private, who are processing those tests. Coming forward when you've got symptoms, even mild symptoms, to get tested, then isolating at home until you get your result, and then taking that result seriously and doing as you're asked over that 14-day period is incredibly important. It's central to this strategy working, and again I thank the very large numbers of Victorians who are coming forward and getting tested. There are 2,758 cases with unknown source. That's an increase of 174 since yesterday, so that's 174 of those mystery cases, which are in many respects our biggest challenge. Even large numbers in known and contained outbreaks are to a certain extent less significant than the smaller number of cases where we simply can't find the circumstance or the point of origin. Where did that person get the virus from? They're the ones that are incredibly challenging from a containment point of view, and that's what's made fundamentally necessary these really very challenging settings, these very difficult decisions we've had to make to drive down movement and therefore drive down the number of cases. There are 994 healthcare workers who are active cases. There are 1,748 active cases connected to aged care settings, and the total number of active cases are 7,854 across Victoria. The regional metro split is essentially unchanged from yesterday, so around 500 cases in regional Victoria. That is those LGAs that are under the stage 3 settings, but I would make the point there are a couple of hundred cases that are still to be investigated by our coronavirus detectives, and as and when we can update you on that split, then of course we will. But that relative stability in regional Victoria is obviously very important to us. Can I just make a couple of general comments, and then as you can see, Minister Foley, the Minister for Mental Health, is here to make some very significant announcements about additional acute care capacity as well as community care, counselling services. We know this is a time of great anxiety, stress and strain, whether it be those who prior to this pandemic mental health challenges were part of their life, or others who may well see relatively low level conditions become much more acute because of the circumstances we find ourselves in, and others who for the first time because of these unique circumstances are dealing with mental health issues. We know that we've already provided very substantial additional support, but as circumstances change, as the needs grow, as these circumstances become more acute, then the appropriate thing to do is to continue to invest. I do want to make reference to one particular element of the package. In some respects it's a very small amount of money in the overall scheme of things, but an additional $250,000 for a very important and existing service, a counselling service for nurses, midwives, personal care workers. I want to thank the ANMF for their leadership and making sure that we understood that many in our health team, particularly nurses, midwives, personal care workers, are doing it very tough. This is a very challenging set of circumstances, and particularly those nurses and personal care workers who have gone into aged care settings in fundamental crisis. You can't unsee what you've seen. There is a degree of trauma, a degree of previously unknown levels of really, really challenging circumstances. It's incredibly difficult in many of those settings. That's not to say it's easy across the board. Our health heroes are doing an amazing job, and it's appropriate that we stand with them, not just with PPE and all the other supports that we provide, but also providing them, if they need it, with the counselling and support services that they need. And to the ANMF, I'm very grateful for their leadership in making sure that we understood that issue. We've already provided some $350,000 to that counselling service a couple of months ago, but as our circumstances change, as needs grow, then we're always there to provide additional support, and this package that the Minister will speak to in a moment will include an additional $250,000 in support so that we can in turn be there for those who are the last line of defence, those who are doing amazing work every hour of every shift in every setting. We're very proud of them, and it's our job to make sure that we stand with them. Just finally, before I ask Martin to take you through that mental health package, we're very grateful, of course, to every single Victorian, and I think it is a growing number of Victorians who are following the rules, doing the right thing. I don't want their quite amazing performance, their effort, to be in any way overshadowed or undermined by a smaller number of people who are doing the wrong thing. There's just a message for those people again. Not only is it the wrong thing to do for your family and every family, it's also the sort of behaviour that will mean this second wave goes longer than it should, these restrictions are in place for longer than they should be, and it's also a sure way to finish up getting fined, because Victoria Police and others are out there in force, and they have the penalties, the powers, and they have the absolute resolve and determination to enforce these rules. These rules are there for all of us, and no Victorian has the right to be able to say, oh, well, I think I can do something that no one else is allowed to do. You've got to follow these rules. They're incredibly important. They are central to this strategy working, driving down movement, driving down case numbers, and then getting to the other side of this second wave. So I want to congratulate and thank and just say how proud I am of all those Victorians who are doing it tough but following those rules. It's so important. To those who aren't, you've just got to make much better decisions, because even one person making the wrong decision can lead to chains of transmission where there are hundreds of other people who get this virus. That will put our stated objective further away. It'll make it harder to achieve those lower case numbers. It'll make it harder for all of us to get to the other side of this. So whether it's to protect your family, every family, whether it's to avoid a fine, or whether it's to get to the other side of this quicker, every Victorian has to do the right thing, and I'm so proud and grateful to all of those who are. Now, as I said, there are many in the community who live with mental health and mental illness challenges each and every day. I think these last few months have made those challenges much more acute for many, and of course these very difficult times, I think, if you like, present their own unique burden. We want to stand with every Victorian who needs care and support, and of course, as you know, we have Australia's first Royal Commission into Mental Health. Its first report's already been delivered. Its final report has been pushed off into the early part of 2021, but we have been faithfully and carefully delivering on the 9 recommendations of the first report, and in many respects what the Minister's about to announce builds on that work. So these are critically important investments today, but more funding, more work and reform in mental health is critically important work every single day. Martin.
Thanks, Premier. So we know that running into this global pandemic, 1 in 5 Victorians every year would seek support for a mental illness. We know that over the course of our life, 1 in 2 of us in the entire Victorian community seek support for a treatable mental illness. And we know that the global pandemic since March has seen a substantial increase in demand for all of the services that state, Commonwealth and community organisations provide in this area. We've invested over $130 million in new programs over that period in time. And most importantly, we, together with New South Wales, were part of the National Cabinet's endorsed proposal for a national pandemic mental health plan, which is in the process of being rolled out. And just in the last few days, we've seen the Commonwealth provide $12 million in extra support for those frontline services, Beyond Blue, Suicide Helpline, Lifeline and others. And then on Friday, the Deputy Premier announced a $26 million package for support for young people in dealing with mental illness, the demands at schools, and the fantastically successful support in school communities and the Navigator program to deliver that intensive support to young people where they need it. And today we add a further $59.7 million to focus particularly on that acute end of the mental illness spectrum in response to the increase in demand that our acute services have seen, whether they be in a clinical setting in a hospital or in a community setting. We know that particularly at the moment, we want to keep those people with mental illness away from particularly emergency departments. Emergency departments are busy at the best of times, particularly now in the height of the pandemic. We want to make sure that we keep those people who need support for mental illness with the support they need in the community. And that's the main focus of today's package, is how to deal with the surge in demand. And I'll just share with you some of the figures that we've seen in the increase year on year. These are figures to the end of July. We've seen a 9.5% increase year on year for presentations for self-harm in our emergency departments across all age groups. For young people under 18, we've seen a 33% increase in presentations for people with self-harm in emergency departments. And overall, across all aspects of how mental illness is presented at our emergency departments, we've seen a 23.3% increase in people presenting in those acute settings with a mental illness. So the object of this package is to make sure that we shift that focus immediately and sustain it over time into more community settings. That is better in terms of treatment for those people, and more importantly, it frees up the resources in our emergency departments as well. And that will take a variety of forms. It will take extending to 7 days a week the area mental health services, community mental health programs, which are currently Monday to Friday, as well as extending the hours. That will be psychiatric support, that will be allied health professional support, that will be data, that will be record keeping, everything that's needed to make sure that those services are closer to where people need them, where they live, and the support they bring. But we also know from the work that is being done out there in the community that we need to more assertively engage with some people in the community. So programs with the Headspace organisations, with non-government partners right across Victoria to make sure that we can identify those most acutely unwell, particularly young people, and take the wraparound services to them in their community settings, where you not only get better results, but you keep people away from the distress of an emergency department where we've seen such a spike in presentations. The program will also extend support to, as the Premier has indicated, our frontline paramedics, our support workers in whether it be nurses, midwives or personal carers, to get the support that they need. More support, particularly through the Phoenix Trauma Centre for police and ambulance workers, dealing with the trauma and the stress that they're all under at the moment. And the program will also make sure that when we have 3 trained clinical professionals in the Ambulance Victoria Referral Centre, to make sure that the mental health components of what goes through the 000 line is dealt with in a way that again gets people the support, the information and the referrals they need closer to them and in their community, and keeps them out of whether it be the ambulance system or the emergency department system. There's also support for our carers. We've seen increased demands on families and carers and people with lived experience directly of mental illness. So there's support for the peak organisations in those areas to provide both material aid, material support to families, as well as further counselling and support efforts. That's a fair swag of the package that's outlined in the media release today. The other component of the release is the fact that we knew running into this global pandemic that our mental health system wasn't fit for purpose, and that's why we've are holding Australia's first Royal Commission into our mental health system to make sure that people get the support where they need it in a timely way. So the other components of today's $59.7 million package go to fast-tracking two major components of the Royal Commission's interim recommendations. Acute mental health beds, particularly in those communities that need them. We had previously announced, as the Royal Commission had indicated, the important work that needed to be done in the Barwon region, the western suburbs, the Melbourne Health catchment and the Northern Hospital catchment as the areas most in demand. We're today announcing the specific locations of the 144 beds that will be rolled out in those communities, and I want to particularly focus on the innovation attached to the hospital in the home programs, acute support delivered by Origin Youth Mental Health Services, the most world-leading program of supporting young people in the northern and western suburbs with acute support in their home, and making sure that that innovation delivers the really world-leading support to get young people and families back on track as soon as possible. The other component that the Royal Commission's interim recommendations spoke of was the HOPE program, the post-hospital suicide prevention program. The Commission had set a timetable to roll that program out around all 23 mental health regions across the state, and today we bring forward the last 7 to accelerate that timetable to make sure that we respond again to those needs. We know that the greatest indicator to prevent someone suicide is to deal with that person in their community when they've expressed suicide ideation or attempted suicide in the past. And the best way to do that is to use our links in our community sector, in our hospitals, and in those communities wrap services around people to make sure that we give them a pathway to recovery. The HOPE program, this whole mental health package, of which this is the third component in the past week, is about telling people we value you, your existence, your role in the community, your life is important. The pandemic is stressful. The pandemic is seeing anxiety and depression levels rise quite substantially, but there is help out there. There is support out there, and all levels of government are cooperating at an unprecedented level with record levels of support to make sure that that message of hope, of resilience and recovery is at the forefront of what we do. So if you need support, call Beyond Blue, call Lifeline, call any number of the specialist service organisations out there and get the support you need, because it is available. I might leave my initial comments there, Premier.
Take any questions you have.
394 new cases today. Can you comment on, is there some sort of display that this is stabilising now?
Look, I think that the story of the last few weeks is that the interventions we made, the steps that we took around stage 3 restrictions, universal mask wearing, all of those settings that are so well known to all of us, have brought about a sense of stability, as the Chief Health Officer made clear yesterday, and I think throughout the week actually, between him and the Deputy Chief Health Officer. We've avoided many tens of thousands of cases, and therefore death rates that would have been obviously substantially higher. But I'm always very hesitant to try and take one day's data and turn that into a trend. What we have to do is all of us acknowledge that the only way this strategy works is that if everyone follows the rules, everyone acknowledges that whether we like it or not, we are in this together, and unless everybody plays their part, from lots of very small decisions, very personal decisions about the choices you make, all the way through to a big team, a team that's thousands of people big, playing our part, then we won't drive these numbers down. Obviously, any day where there's less cases than the previous days is a good one, but I wouldn't want to be trying to predict. I wouldn't want to take one day's data or even a week's data. The other point to make, Dougal, is that, look, we have had only just a couple of days of the stage 4 settings. In fact, some of them don't actually kick in until midnight tonight. So we're probably seeing perhaps the tail end of the stabilisation that was the product of those stage 3 rules. But that's still got an R0 at about 1, maybe just under, so that means every person who's got it is giving it to at least one other. We've got to drive that down so that it's every second, every third, every fourth person who's got it is infecting someone else, and that's how we'll see the numbers halve and halve again and halve again and come down to that much more manageable level. That will essentially take time.
With Queensland likely to host the AFL Grand Final, will you be pushing for a night match so that it doesn't clash?
Look, I think that trying to just, as I've just indicated, trying to predict numbers a day in advance, let alone what's going to be happening mid to late October, is very, very challenging. They are basically matters for the AFL in the first instance. We're having discussions with them. And I'll freely concede that I nor any of us can predict where this virus will be in a number of months' time. What I can say, though, is the types of events that are run in Melbourne in October, the types of rules that apply to every Victorian in October, the types of the number of people that are in hospital in October, that'll all be the result and the product and determined by the number of Victorians who do the right thing right now. And I think it is important to acknowledge, at least from some of our early reports, some of the compliance data that we have received, that a growing number of Victorians are doing the right thing. And that's something that makes me proud, and it should be another important reminder to every single Victorian that even the choices that one single person makes, if they're bad choices, they can lead to a chain of transmission and infection that is dozens, indeed hundreds of people. So we've all got to make those better choices, and thank you so much to those who are. And that'll relate to what October looks like. It'll relate to what 2021 looks like as well.
268 fines in the past 24 hours, though. That's up by a few dozen on the previous, record for a 24-hour time period. Are you disappointed by that?
Well, each of those penalties can be avoided. Each of those penalties are the product of people making choices that they shouldn't have made. Each of those penalties are the product of someone saying to themselves, oh, well, I can do things that no one else is allowed to do. And that's not the way this works. Those sorts of choices will simply mean these rules are in place for longer. Those sorts of choices will mean that businesses are closed for longer, that people are unemployed for longer, and that more people are in hospital. And sadly, tragically, that more families are planning funerals. So again, I just want to stress, I do not want a situation where the bad behaviour, the poor choices of a smaller number of people in any way detract from, I think, a growing number of Victorians who are doing the right thing. But I just say these rules are binary now. Now the curfew is there, permit system is there, stay at home means just that, and that means perhaps it's a little bit easier for Victoria Police to enforce these rules. And on that basis, they're out there, they're not mucking about, they know, I know, and the vast majority of Victorians know just how important compliance and following these rules is to all of us getting to the other side of this.
Were any of the deaths healthcare workers?
Sorry?
Were any of the deaths healthcare workers?
Not that I'm aware of, no. I'm sorry, did I indicate, if I didn't, let me just confirm for you that 10 of those 17 deaths are linked to aged care outbreaks. I've got no further details on any of those, but I'm certainly not briefed that any of them are healthcare workers.
I'm just hoping to go back to the 200 or so odd fines that have been issued by Victoria
Yes.
Police. It's silly of us to assume that every single person in Victoria is going to follow the rules. There have always been rule breakers, and the pandemic isn't going to change the behaviour.
Correct.
It's normal human behaviour. So I guess, what kind of research are you doing, or what kind of engagement are you doing with communities to actually and properly understand why they might not be following the rules? Because sometimes it's not as simple as, they can't be bothered.
Sure, there is enforcement for a reason, and the enforcement, this is not an honesty policy. This is not a, here's what you got to do and we won't check that you're actually doing it. We've got enormous numbers of resource people out there working day and night to make sure these rules are followed. Because as you say, there will always be a percentage who make decisions that they think are much more in their interests rather than the community's interests. The point here though is it's not in your interests. I've had to stand here the last few days and report 2 people in their 30s who have died just today, 2 people in their 50s. The notion, and around the world, people who are otherwise healthy of all ages have died because of this virus. It's a novel virus. It's called that for a reason. We don't know everything about it. How it presents long-term impacts. You've heard me speak many times about the fact that there's growing global evidence that this is not like a cold where you simply get over it and a week or so later it's almost, you can barely remember that you had it. There are growing numbers of people across the world that are reporting that this lingers like a chronic condition, like a chronic illness, where there is an impact over a period of time. In terms of community engagement, we engage with, whether it be based on geography, gender, age, multicultural background. There's a massive team of people that are out there engaging, and it isn't just talking, Samaya, it's about listening, and as you say, trying to get the most acute and contemporary knowledge, the best understanding of what might be driving people to make bad choices. And I'd say that there are, it's not so much that there are patterns, other than to say there are a number of people who perhaps don't regard this as seriously as they should. We do know that there have been some people for whom economic and very personal financial circumstances have driven some of those poorer choices. For instance, going to work when you should be waiting for a test at home, going to work when you've actually got a positive diagnosis. That's why the federal government and our government have been working so hard on those payments around while you're waiting to get your test result, and indeed payments, essentially pandemic leave, for those insecure workers, casualised workers, who don't have sick leave to fall back on. But we're in constant contact with community leaders right across the board to try and have the most up-to-date sense of what's driving not just the bad behaviour, but also what's driving all the good behaviour that we're seeing. And there's a lot of that. There's a lot, and I think it's actually growing.
What are they saying? Because, since the start of the pandemic, you've been at this podium, every day for more than a month now saying the same thing. Police will fund you, this isn't just an old person's disease. 2 people in their 30s passed away recently. That's been your consistent message throughout. It's obviously not getting through to a small number of people who aren't.
Yeah, to a small number of people. I'd also make the point to you that I've stood here every day for a long time now saying if you've got even the mildest of symptoms, come forward and get tested. And yesterday we processed, despite the fact that we have substantially limited movement, and it's not exactly the greatest time of the year to be going out doing things, but the laboratories processed yesterday, if I can find the figure, it's here staring at me, more than 40,000 tests. So 41,416 tests. So look, I think that a growing number of Victorians know and understand that this is a battle, this is a fight, the likes of which we've never been engaged in, ever been engaged in. But we overcome fire, we overcome drought, we overcome lots of challenges. We are a resilient people, but everyone has to play a part in that. And that's why I'm simply saying I don't want to distract or detract from those who are doing the right thing, but to those who aren't, and particularly anyone who makes persistent decisions, who makes consistently bad choices, Victoria Police are out there and they will fine you, and the fines are higher than they were. The best part of $5,000, and if you are really just flouting the rules, then there are other options to take you to the magistrates court, and the fines get substantially bigger. But again, let's not. It's important to call this out, but at the same time, let's not take away from the fact that I believe, and I think the data supports this, a growing number of Victorians who know and understand that these are the rules that will get us through, and therefore they have to be followed.
On the fines, Premier, are you worried that people simply not pay them and fight it through the courts, and that won't really act as a deterrent?
Oh, well, people always have a right to challenge penalties that are issued, but these fines are levied for a reason, and we will be coming after everybody who has done the wrong thing and has been caught and has been fined. Anyone who thinks, well, I'll put it to you this way, the notion that you can make really bad choices and take the gamble that you won't get caught, that's not a very smart move, because Victoria Police are out there and they are catching people, and they will continue to do that. Anyone who thought to themselves, oh, well, I'll just cry poor and I won't have to pay that fine, that wouldn't be a very smart choice either. These penalties, this could not be more serious. This is a challenge, a fight, a battle, the likes of which we have never experienced before. And unless all of us, to the best of our ability, make the right choices, then we'll be in this longer than we should be.
How many healthcare workers were in those new cases today?
I've got, just bear with me 1 second. I might need to come back to you with a comparative number, but I've got 994 healthcare workers who are active cases. I don't to hand have yesterday's number, but I'm more than happy to chase that up for you.
With that, does that having 1,000 healthcare workers out of the system at home isolating, at what point do we start having shortages?
Yeah, look, we've done a lot of contingency planning, a lot of work to try and make sure that we've got surge capacity, that we've got people that we can call on, and that's the amazing nature of our healthcare heroes. And I don't think anybody in the clinical team will mind me giving a shout out, not just to them, so ambos, nurses, doctors, but also cooks and cleaners and orderlies and ward clerks and all the other people in the hospital system. They're all doing a fantastic job. And aged care as well, they're all doing a fantastic job. We think we've got the reserves that we need, but there's a lot of stress there. There's a lot of stress, there is some pressure, and that's just another reminder. Avoid a fine, get out of this quicker, thank and honour our healthcare heroes for the work that they do. What motivates you to do the right thing is less of a concern to me. It's just about making sure that we get to the other side of this quicker. We've got enough capacity, but every time we have another person admitted into hospital, every time we have another healthcare worker who either because they've got the virus have to isolate, or because they've been in contact with someone who's got the virus, they have to isolate, that does put additional pressure. Not just on the system, but it puts pressure on their family as well. The reason we've announced these additional counselling and support services for our nurses, for our midwives, for our personal care workers, together with existing arrangements that Ambulance Victoria have grown very substantially over the last 5 or 6 years, is because there's a lot of stress, a lot of trauma that comes with a lot of this work. Let's not make that challenge harder. Let's not give our nurses and others a bigger job to do. Let's play our part and limit activity, limit movement, and then ultimately limit the number of cases.
Premier, should those workers feel safe?
Well, every step is being taken, everything that can be done. I think yesterday I took you through a very substantial list of different PPE that we have in the warehouse. There is PPE going out to hospitals every day, aged care facilities every day. There are large shipments of additional PPE coming to us, if not every day, but certainly every week. That stockpile is very, very important. Every step is being taken. But again, yesterday we saw a survey. College of Nurses had done a survey, and that's why we're engaging with them to better understand exactly the challenges and any sense that there might not be everything that's needed. So it's not a static thing. You've always got to be monitoring this. You've always got to be trying to respond to the challenge, and it is something that presents a bit differently every single day.
I was hoping to ask a follow-up question.
Sure.
To mine. There needs to be a level of pretty sophisticated and deep engagement with these communities.
Yes.
And the question that I had asked was, what have you heard from these communities? And I'm not just talking about multicultural communities, but different groups of people, different industries. And how has that changed your comms and messaging? Because as far as I can tell, it hasn't, because you've been saying the same thing consistently for a very long
Well, Samaya, I'm not going to sit here and try and be someone who interprets the effectiveness of our messaging, and nor am I going to be singling out particular groups. Those who are doing the wrong thing know and understand exactly who they are. Sometimes their behaviour and what motivates it will be a mystery. I wouldn't necessarily agree with the criticism that you're making. We are, all of us, working as hard as we can, and of course, not every Victorian is necessarily watching this broadcast now. We use many other platforms, many other platforms, but I think a growing number of Victorians are doing the right thing. That says to me that the seriousness of this challenge is well known and is motivating the best of choices. But there will always be, as you said, I think you opened with the point that there will always be a percentage of people who make bad choices. That's why we have a Victorian Police Force. That's why we have a statute book that we add to all the time. That's why, unfortunately, we have to be out there spending enormous amounts of your money making sure that rules are appropriately policed. We're always looking to refine our messages. This is one platform. It is not the only platform. We use lots of different ways to engage. Sometimes traditional media, sometimes me answering questions. Other times it's through alternative platforms and direct engagement, literally knocking on people's doors. I would say to you, for instance, the authorised officers of the health department and ADF going literally door to door is a very important way in which we can better understand and hopefully have a situation where there are better choices being made. That's not just about compliance. I know I've made this point a few times, but it's not just about compliance. It's also about making sure that if anyone needs anything, we're there to provide that for them. But that's not something that's happened in other states, but it is happening here because we believe that's an innovative but common sense way that we can get the message out.
Premier, how much is it costing to have hotel quarantine staff to be paid whilst they're on standby at the moment?
I think I need to come back to you with an exact number, but I just want to be very clear about this. We're not having any international flights come back, but there are some people now in a program that's been reset under the auspices and the direction of Corrections Victoria that do need to be supported. So whether that's nurses and other healthcare workers who can't isolate at home, they want to protect their family, for instance, or they need to be protected from somebody in the household who's got it or is a close contact. So that Hotels for Heroes program, some residents who came out of the public housing towers, for instance, where it just wasn't conducive for them to isolate and keep everybody safe, including themselves, unless they went to a different place. So there are significant numbers. I can come back and try and give you an exact figure. It's not anywhere near the volumes, but having a workforce on standby, having people ready to be able to do that work is very, very important. But it's the international arrival part of the program is that is basically off for a period of time, but the program continues in lots of different ways. They are different, but ultimately we have to make sure that we are providing people who need that care and support and need to be away from others, providing them with the best and most conducive environment for that.
Would you be envisaging we'd be coming back to the similar sorts of levels with the hotel quarantine?
Yeah, look, it's a very important question. It's really challenging to get an estimate of how many people, how many Aussies, and it's not just Victorians, because we had more than 20,000 people come through the program. We had many people who were not necessarily from Victoria, but the flight came back to Melbourne, and then they did their quarantine here and then moved back to their home state. We will again reopen that program at the appropriate time, but it's really hard to get an estimate of how many people will want to come home, and that'll be some who perhaps had deferred that decision, others who needed to stay where they were because work arrangements meant they needed to stay. It's a really difficult thing to try and calculate. But National Cabinet on Friday, this was less about Victoria, but in a broader context, there's some caps and limits that have been set on the number of people that can come back. If you look around the world, there'll be many people who have got ties to this country, who because of the very challenging, in fact terrible scenes that they are part of in the country that they're in now, with the virus running wild. They may be motivated to come back. We've got to be compassionate. We've got to be, you'd never want a situation where somebody who was a citizen or a permanent resident wasn't able to return. But it is challenging, certainly challenging in terms of trying to forecast how many people might want to come back.
Jenny McCarkos tweeted last night that she was deeply sorry if people think her efforts thus far are not enough. What are your thoughts on that?
Oh, look, I think everyone is working as hard as they can. It is a massive team, a very, very big team, and it grows by the day. And I'm grateful to each and every one of them. No second wave around the world, and no country that is dealing with a second wave of this wildly infectious virus is pleased to be there. No one wants to be in a situation where we've got to make some of these heartbreaking choices. But everybody across the team is working as hard as they possibly can. But even a team that is many, many thousands of people large, cannot do this alone. We need every single Victorian to play their part. That's why I'm so grateful to those who are doing the right thing. That, I think, is a growing number, but we've got to see that number grow even further. Some of our public health experts tell us that unless you start achieving, compliance numbers that are in the 90s, not necessarily 99%, but are certainly higher than 90%, then it takes longer to achieve what you might want to achieve. That's why I think, despite the fact there have been some fines issued because of people breaching the curfew, again, the vast, vast majority of people are not doing that. They're staying at home. Whilst there's been some fines issued for people who are not isolating when they should, again, the vast majority of people who should be isolating are. And I think those numbers are going up. That'll be proven out by the data over time, and it's a bit like case numbers. One day's performance doesn't necessarily give you a trend. But my sense of it is, just again driving in this morning, very, very little traffic. The data shows that as well. If we want to get past this, if we want to get to the other side of it, then each of us have got to make choices that are conducive with that and the strategy working. I know it's hard, it's incredibly difficult. There's nothing easy about having to make these choices either, having to make these decisions, but I've made them because it's what our experts say and it's what will work.
It's quite an emotional series of tweets though. Have you spoken to Jenny this morning?
No, I haven't spoken with the Minister this morning.
Have you read the tweets and what do you think of
I've not read them in full. I've had some, they've been conveyed to me. Again, everyone's working as hard as they possibly can, and it is a big team. It's a team that is 100% focused on the challenge we face, the biggest challenge we've perhaps ever faced. But there should never be any sense that this team is not completely and utterly motivated. And when I say team, it's thousands of people, thousands and thousands of people, and they're all working as hard as they possibly can. Some of it's pretty visible because they're in uniforms, some of it less so. Some of them, in fact, are not even in Victoria. They're in Sydney and Adelaide and Perth, and they're making phone calls, doing case interviews. It's a big team. I'm grateful to all of them.
As Candace said, it was quite a heartfelt string of tweets, but is she holding up okay? It seems like it was quite well thought out and watching.
She's a very strong person. And as I said yesterday, I think there were some questions about my welfare, which I didn't think were necessarily relevant. This virus doesn't stop, and none of us can afford to either. And I won't be. We will see this through. All Victorians, we are resilient, we are strong, but anyone who is doing it tough, this package is designed to support them. There's $60 million worth of additional mental health funding. So many of the other things we've done are all about supporting those for whom this presents an even more acute challenge. But ultimately, these are heartbreaking decisions to make. These are very challenging settings to put in place. But unless we do this, this second wave will not end anytime sooner. As I said yesterday, and I think trying to be as clear as possible is very important. If we don't limit movement, if we don't follow the rules, we as a state have zero chance of driving down these numbers. It won't happen by accident. It won't happen because of good fortune. It won't happen because of the passage of time. We need to make these decisions. That's why we have, and we need to make them work. As challenging, as heartbreaking, as difficult as that is, There's just no alternative. This virus is a wicked, silent enemy, and it will only be defeated if we have a united front against it, and that is about everyone making the best choices, and that's why I'm so grateful to the vast majority of Victorians who are.
In Melbourne's outer suburbs, like particularly the north and the west,
Yes.
people generally rely on cars to get around and cars to get to testing centres, for example, and some
Yes.
people might not have those cars. How do you engage with those people, and I guess how do you ensure that those people do get tested? People who might not have a means of getting to a testing.
Sure. I think that we've put in place, I can come back to you with some more specifics, but I think we have put in place arrangements to go and do home visits to take the testing protocol to them where people simply can't go out. There are a number of drive-through sites, but there's also many tests that have been conducted through much more, I think, long-standing arrangements, GP clinics. There are lots of tests being done through pretty familiar settings. And I think people find a way, whether it be with a family member, whether it be using public transport again, getting tested. We want people to do that in as contained a way as possible. We don't want people spending time with others. But I'm happy to come back to you and give you some further detail on some of the different things we've done. I know that we have gone door to door. I know that we have gone out to people who, for one reason or another, just aren't in a position, and it perhaps wouldn't be safe for them, let alone convenient for them to go and get tested.
Just on the point that you made, that people might be using public transport to get to places, then if you don't have a means of getting to a testing centre,
Sure.
and you need to isolate obviously after
Yep.
getting a test, can you use public transport to go back home?
Oh, I don't think we would. We would.
How,
Look,
yeah.
I think that we're asking people to use common sense as best they can. And obviously, if you've got symptoms, and this is symptomatic testing, the only asymptomatic testing that's going on is a much more proactive relationship where public health officials would be talking to a given worker in a workplace, for instance, or a person who was a close contact. So it's someone who's got symptoms. Those symptoms have prompted them to get tested. If you're symptomatic, then you can potentially be highly infectious, and we would want to see you staying away from as many people as possible. We know that's challenging. That's why we have done some home testing. If we have to do more of that, then of course we would. There is, I know, one of the reasons I say I'll come back to you is I think that ADF and authorised officers of the health department, when moving, doing those door knocks, which now must be close to 6,000 or more, I think they have facilitated some testing. I'm more than happy to try and get some further detail on that.
For home tests, is there a phone number that you can call? Or?
I think the coronavirus hotline would be able to provide you with some information. Let's get you some numbers. If there's any different numbers, I'm more than happy to get them for you so that you can make them a feature of your coverage.
Premier, can businesses other than banks and bottle shops request people take off their masks for identification purposes before they walk in?
Yeah, I know that there's been a bit of coverage in relation to convenience stores, so petrol stations, convenience, 7-Eleven I think was one of the examples. Look, we don't want a situation where people are removing their mask. However, there's been advice from the experts, and we think it's a difficult balance, but it is a balance point so that people are not using the public health steps to potentially obscure their identity while they might do something illegal. So it's challenging. It's very challenging, but we think that's a common sense exemption, and one that I'm confident comes from the best of public health advice. This is part of the challenge. We've never done this before. None of the settings across the whole spectrum of human activity across Melbourne and indeed regional Victoria countenance the notion of wearing a mask. It's completely unique, it's completely new, and therefore there'll be from time to time some of these areas that need to be tidied up.
Only 10 deaths linked to aged care and reports of a class action against St Basil's. Do you think this type of action is necessary against some of the private operators in this space?
Look, what I'd say is I and my team, a team of thousands of people, are focused on residents, their care, their dignity, and making sure that we provide for them as best we can, and indeed the families of those residents. There'll be a time to deal with some of those underlying challenges. People are well aware, and I think properly acknowledge that this is a national system. There are a couple of hundred public sector aged care facilities that the state government runs. There are then many hundreds of others which we do not run, but that's not the point here. That is not the issue. The issue is how do we provide the best care to everyone who needs it, and that's why must be getting close now to 1,000 shifts where hospital nurses, we've sent them in to essentially take over some of these places that were in acute crisis. We've moved many residents into hospitals, both public and private. We're now in a situation where some of these facilities can be handed back to their non-government private sector owners, the people who run them. But I think we're also trying to leave in place a number of nurses, just like a blended team, to make sure that there's complete confidence that everyone knows what to do with infection prevention and control, with care. These situations can change quickly. Something that appears stable today may not be in 36 or 48 hours. So having that ongoing, the link back to a public hospital, for instance, and again, I probably shouldn't do a list, not off the top of my head, but I know Monash Health have done an amazing job. Eastern Health, the Austin, the Northern Hospital, there'll be others, but just they're the ones that come to mind, as well as a number of private hospitals also. These are deeply distressing scenes. There is a Royal Commission. It's doing its work. That's a national process. That's not a process that's run by us. But they'll look at all these matters. As for people, taking court action and things of that nature, I wouldn't comment on that. Key point is this. My focus exclusively is not on who's in charge of what, where the lines are drawn, those sorts of things. My exclusive focus is on those residents and their families and making sure they get the very best care we can possibly offer.
Of the current active cases, do we know how many of them are residents in disability homes?
I'm happy to come back to you on that. I think that we've got in the order of active, I think it's in around the order of about 70 cases. That's a mixture of clients as well as staff. But the best thing for me to do is probably to come back to you with some further detail.
And have there been any deaths from people who moved or working?
I would need to double check on that, and of course I would just with the greatest of respect, I just make the point that sometimes if you have fatalities at very, very low numbers, we've always got to be careful not to be identifying people, and sometimes identifying a given setting can in effect identify that person. There are complex circumstances, varied circumstances for every single one of the people who have passed away, and I'm always respectful of their families' wishes, and I'm just not going to do anything that might be at odds with that. But if I can come back to you with further information, I will.
The founder of the Jim's franchises, Jim Penman, has written you an open letter calling for your resignation if you don't allow sole traders to continue to operate under stage 4 lockdown. Is there any chance of changing those restrictions?
Well, I would just say to that individual and to all Victorians, if I were to agree to every letter, whether it be an open letter or not, every impassioned plea, if I was to agree with all of those requests, if I said, look, it's all too hard, and I'll say yes to everybody who asks, we will have more people at work in August than we had last month. And that will mean this simply goes on for a very, very long time. I understand and appreciate that these are very challenging decisions for businesses and workforces, for families, for individuals to live with. They're very, very challenging. They're not in any sense easy to make either. They are heartbreaking calls to make. But the simple fact of the matter is this: if every person who came to me and argued passionately, eloquently, whether it be publicly or privately, that they're low risk and that they should get a pass, they should be able to continue pretty much as normal, then we will finish up with more people at work and more people moving around the community in August than we had in July or June, and that'll just mean we have zero chance, like no chance whatsoever, of driving these numbers down. That's what's guiding us. It's nothing more or less than that. Follow the advice, deliver the strategy, get to the other side of this as soon as we can. And I would just say to that individual and anyone else, I appreciate that this is very painful, very difficult. But any economic benefit that might be derived over the next 5 or 6 weeks by a carve-out won't mean much if instead of this being a 6-week lockdown, it's a 6-month lockdown. That's the other point that I think has to be made. As respectfully as possible, I'm not for a moment criticising someone for feeling pain and grief. This is not the situation that any city or state anywhere in the world wants to confront, but second waves are a reality of this virus. These settings, this strategy will get us to the other side.
What's the danger of gardening? What's the danger of a gardener gardening or a pool cleaning a pool in the backyard?
Well, as I've said many times, the aggregate risk, the aggregate challenge, if you've got people moving around the community, and again, the person is not going to be in one place for the whole time. They will move around the community. We have seen mystery cases, as I've said many times, one of our greatest challenges. People who seemingly have caught it from each other, have never met each other, have never, to the best of their knowledge, been in the company of each other, but live a street or two away and may have some shared services, whether it be the local convenience store or wherever it might be. The judgment of the experts, and again, people are free to have a different view, but what I'm not free to do is because that person or any other person mounts an argument, I'm not free to simply say to the public health team, the chief health officer, oh well, doing what you say will get us past this is all too difficult, so I'm going to ignore your advice. I don't have that luxury. And I understand it's very challenging. It is very challenging, but I'll go back to my central point. If every person who came to me and said, I'm low risk, give me a leave pass, let me continue, then I'll have more people, we will have more people at work this month than last month. And that will mean that it is impossible, absolutely impossible, to drive these numbers down.
I've been getting a logistical question a lot, hoping you can
Sure.
clarify. Can people work, exercise or go to the shops in a 5-kilometre radius around their workplaces if they're a committed worker?
No, you're supposed to be within 5 kilometres of your home. I'm happy to seek further advice though if you're at work. We don't want this to be any more onerous than it needs to be, but of course, again, this is about limiting movement. Being a permitted worker, working in place, so going to your workplace, we've dramatically reduced that. We've tried to get it back to those parts of the economy, those functions in the economy that we really can't do without. Let me get some guidance on that. It's not a question that had been put to me, but it may have been put to the public health team. They may already have dealt with it. Sure. I'm sorry, I might just ask you to speak up. I know it's difficult with the mask, but I can't quite hear.
In the Geelong region this year, there's been at least 5 youth suicides.
Yes.
What exactly are you doing to prevent suicide, not just the overall mental health?
Yeah, so obviously the HOPE program, which is about wrapping around supports to people who have either expressed an intention to self-harm and to take their own life, or those who have physically attempted that but have been unsuccessful in that attempt. That HOPE program, which is it is an amazing program and one that Victoria leads the nation with. One of the recommendations of the Royal Commission was that be extended right across the board. Today's announcements add to that and bring forward the universal rollout of that program. It just makes common sense. There's so much innovation. The very best of innovation is so often just common sense. The rolling out of that program so that anybody who's got suicidal thoughts, anybody who's tried to act on those thoughts, gets that wraparound service, very personalised, very local, in a familiar environment, in a non-clinical environment wherever possible. Of course, there will always be some who need to be admitted and need to receive that much higher care, but that is one of the most thoughtful and effective programs that we've seen in mental health for a long time. I would also make the point, I think some of the references you made related particularly to younger people. The work that Pat McGorry's doing, the work through Origin, the work that Headspace Centres are doing, the work that's happening right throughout our secondary school system, and the announcements that the Deputy Premier made this week, I think will be very, very important. But we're going to monitor this very carefully, and every one of these deaths is a terrible tragedy, and we need to make sure that we're always looking to do more and to do better. And that's That's where the Royal Commission comes from. That's the place where the Royal Commission comes from, a fundamental acknowledgement that we have lots of mental health services, but we don't have a mental health system, and that 1 in 5 Victorians who experience mental illness every year are not getting the connected, efficient and effective treatment that they need. That's in no way a criticism of those who are passionate and work so hard in this sector, but all of us have failed them for a long time. And that's why we've got a process where we've said we'll implement every one of the recommendations, and that's exactly what we'll do.
Can I ask the Minister?
You certainly can.
There are a number of people who live alone, for example, who might either have...
I can't hear you.
Sorry. There are many people who live at home alone who might
Yes.
need mental health support, or who might just need their friend. They might not have mental health issues, but just need their friend for support. Would you allow those people to, I guess, is it even necessary? Would you allow to support people in people's homes? Because I know you're not allowed to visit people.
What was the? Would I allow them to?
Would you allow people who need friend support or family support to nominate a support person for them?
Well, it's pretty simple. The public health advice is to minimise the movement around the community. No one wants to see the virus last a moment longer than it can. We know that that comes at the restriction of substantial movements for lots of people. And we know that we can put in place alternative supports, particularly digital, particularly for people who are at risk, and that might include people who live alone. That doesn't preclude people who have that responsibility. They can still be permitted workers if their circumstances are sufficient, or indeed they could still be the subject of care provision or caregiving. But in terms of the specific New Zealand type exemption, no, we don't have any intention of applying that.
Just on that issue though, we might try and get you an update on, we've got a lot of outbound phone calls being made, lots of welfare and support trying to check in on people that we already know are vulnerable, and you would recall that every summer, whether it be for heat waves or for bushfire, we talk about the register of vulnerable persons. That's not by any sense a complete list of people that are vulnerable for one reason or another, but we're trying to reach out as much as we can, and that'll often be particularly people that have got some underlying conditions. They may live on their own. They don't have that strong support network to fall back on. It's why the door knocking, I know I've made this point a few times, but you know, we've filled scripts, we've gone and got shopping for people, we've done lots of things to try and support people who are doing the right thing. They're at home where they should be, but they maybe need a bit of clarity, they need some guidance, they need really practical things. So it's as much about what we can do for you as checking that you're doing the right thing by everybody else. So perhaps I'll come back to you with some further information about some of that outbound work that we're doing.
Can I also just clarify, if you don't have a diagnosed mental health issue but you're feeling in the dumps, you're really upset, stressed out, if a family or family member or friend comes home to visit you, would that be under the guise of provision of care?
Well, what I'd say to you is care. So getting care and giving care is a permitted reason, but the threshold is higher than it was at stage 3. So where you can put in place an alternative arrangement, you should. Urgency is what drives this. Otherwise, again, without running a commentary on any group in the community or the community at large, we can't have a situation where it is impossible for police to enforce this by virtue of a pretty loose category that you can use to essentially get around these rules. If it's urgent, if it's genuinely urgent, then that's different. But a lot of people are doing it very tough, particularly those who perhaps already feel that sense of isolation. But if we had a big exemption, a big opening up of these rules, then some, back to your earlier point, there will be some who use that to make very bad choices. And we're sorry for the impact that has on those who wouldn't, but that's kind of where we're at. Any other issues? Thanks very much. We'll see you tomorrow.